talk about the concept of a mental breakdown, not exactly a disease or an illness, sort of an event that could be a symptom of something else. What is a mental breakdown?
So a mental breakdown is, as a person, you just cannot cope with whatever it is that is happening. It may be something huge, like the death of a loved one, and it may be that somebody spilled a drink on you or cut you off on the highway. It really just depends on somebody's constitution, and that's a very important factor when you're dealing with someone who's experiencing that. And there's warning signs. How tightly wound is somebody? Are they using drugs and alcohol? Are they, sort of addicted to, impulsivity and sort of, like to have a little bit too much fun? Maybe they're, some of the shenanigans that they get into. Their relationships are turbulent. You start to just see where a person could end up with a mental breakdown. Another aspect of it is lack of coping skills, like lack of how to deal with life in general. We've had some patients here. They look good, they smell good, they're well educated, right? And they come in, they're like, I don't know how to cook, I don't know how to clean, I don't know how to make my bed. And if you take that, you're intelligent, but you have no insight, you really could crack. You really could have a mental breakdown because of that.
So it's not synonymous with active psychosis necessarily. That could be a feature of it.
Correct.
But it could also just represent some sort of threshold after which somebody crosses. They're at a place where they need treatment.
Yeah, and a lot of times it has to do with the adjustment of life. You see a lot of mental breakdowns with young men and women 18 to 25. They go to college or start a new job, and they have a mental breakdown. It doesn't mean that they had a psychotic break. It doesn't mean that now they're suicidal and depressed. It means that they had an adjustment disorder. They have something wrong with them for a short period of time. That being said, if they don't address it, it'll address them, and it could turn into something worse.
So how do you treat it?
I mean, I would treat a mental breakdown the same way I would treat some of the symptoms of anxiety, depression, mania, all of that stuff. With cognitive behavioral therapy, identifying some of the irrational beliefs that somebody is hanging on to, challenging that, working with the patient on successes that they've had, big or small, working with the patient on keeping them optimistic and motivated and disciplined to what they can do to work themselves out of this so it doesn't get worse. So a mental breakdown to me, metaphorically, is kind of like you're in quicksand, and if you don't do anything, you're going to slip into the quicksand. You're going to succumb to it. It's going to pull you down. But if you're patient and you're slow and you're methodical, you can pull yourself out. You can put yourself in a position to get out of the trouble that you're in. So that's sort of what it's like.
And then once somebody's sort of stabilized, when would you consider them having gotten out of the breakdown and now gotten to a point where ongoing treatment is needed, but more to stabilize and continue progress versus still in the breakdown?
So there's a couple of factors, but there's two that stick out for me. One is if a person can verbalize what they've experienced in an intelligent, coherent, chronological way, I feel a lot better about their situation. It tells me that they've got some insight. It tells me that they can discuss the event rather than avoid it. And then the other thing, and this is critical, is forward thinking. Can a person start to put together a plan of success, a plan that includes what you just said, therapy, medication, exercise, nutrition, whatever it is, so they stay away from the pitfalls, that they fell into. Those two factors can be instrumental in avoiding a mental breakdown.
Great. Thank you.